Hi, Thomas.
How are you?
So what's Apple Research Kit about?
From the perspective of somebody who's living and breathing clinical trials and clinical research, I think it opens up a whole new way of creating efficiencies in what is right now extremely wasteful and unproductive system. It's open source. Anyone can contribute and make tools that are used to collect data from patients in clinical trials better, more efficient, and more patient-centric.
And why is Apple doing this?
Well, I think they see it. I can't speak for thinking internally in the company, but I think the writing is on the wall. This is a hugely underserved market, clinical trials. Just to give you a number, if you look at big pharma and contract research organizations, they all complain that they can't get patients into clinical trials. So you would think that the supply is exceeding the demand, but it's actually completely pervert. Only 4, maybe 5%, single digits of patients with chronic diseases who are target for these clinical trials do participate in these clinical trials. So the supply is much, much bigger than the demand. But the fact that it's being made so convoluted and so patient-unfriendly gets us to the situation, a schizophrenic situation where there's tons of patients and very few participate. The consumer-driven and consumer-focused company like Apple can make it better. And they're doing it their own way, which obviously is quite poorly understood by pharma. But I think it was probably the most significant announcement of this Apple Kit in clinical trial space in many years. So Apple obviously sees market potential. They're a for-profit company.
So just one last question. I mean, you're a really busy guy at an event like this with this Genie Tech deal under your belt as a self-funded startup. I mean, it's incredible. How do you make money in this market?
Well, talk to me.